Hey guys, Tony Maritato here, licensed physical therapist, and in this video I wanted to quickly explain to you what you can expect from the post-surgical sling that you'll be wearing after your rotator cuff repair surgery. So behind me on the screen you can see Amazon. I'm looking at some of the slings that include the abduction pillow. So if you can look closely, right in here behind there's a cushion. You can see it here also kind of underneath her forearm. There's a cushion that helps hold the arm away from the body at about 30 degrees of what we call abduction. But a couple of things that they don't do a good job of here. If you notice in this first image under the Amazon choice, you can see that her hand, her wrist, is lower than her elbow. So if that is the case, what's going to happen is you're going to get a lot of swelling and fluid accumulation into the hand, the wrist, the fingers. I call it sausage fingers. I've got another video talking about it, but it starts to become pretty uncomfortable. So you would always want the forearm to be at least horizontal. I always say the wrist just slightly above the elbow, and we want to line it up so that it's more kind of in neutral with the body. So my palm, the center of my palm, would be where kind of the middle of my sternum, there's something called a xiphoid process. It's that little bony bump at the bottom of your sternum bone, middle of your chest. That's where we want the hand to be. And so positioning that before you have your rotator cuff repair surgery is really helpful and important. Getting the sling a couple days before so you can fit it properly so that you know how you're supposed to wear it, getting on and off without using that arm is always a challenge after surgery. So if you can have it a little bit before surgery, even better. And then something else that I would recommend, if you notice this individual here in the red tank top, she has a secondary strap over the non-surgical shoulder. It's a Y or a split strap that helps take the pressure off the base of the neck. So if you're looking at the person on the left in the white shirt, that strap is cutting into the side of the neck over the brachial plexus. That could potentially lead to harm, discomfort on the non-surgical side. I love this little attachment, and most of the time it comes with the sling you're going to get from your surgeon. It's just people don't know how to apply it, how to put it on. So using that, it'll take the pressure off the base of the neck, move it out over onto the non-surgical shoulder a little better, make life more comfortable. But really, if you look at the pricing here, you've got this off-brand $36, $37 sling. You've got the DonJoy, which is the main brand that everybody uses, for $97. Depending on how you're covering the cost of your surgery, in most cases, your surgeon and your insurance will cover the cost of your sling. But if you are looking for a way to manage costs a little bit better, Amazon and other retailers do have an incredible deal on some of these slings that, you know, if you're going to get it ahead of time, you might consider some of these. So guys, I hope this was helpful. If it is, do me a favor, subscribe to the channel. I'm trying hard to answer specific viewer questions, so feel free to post your questions in the YouTube comments, and I'll see you on the next video.